Idiopathic telangiectasia of the face can be treated by shortwave diathermy. Facial telangiectasia, more commonly known as facial thread veins or spider veins, are very common and are disfiguring and unsightly. They are usually caused by sun exposure, but other important causes include rosacea, liver disease, excess alcohol, smoking, and prolonged use of topical steroid creams. I use the Silhouette Dermalift shortwave diathermy machine. The electrical current is applied to the thread veins using a very fine, single-use, sterile, disposable needle. The skin is numbed with a topical local anesthetic cream. The thread veins are treated by applying the correct amount of pressure to the thread vein. As the current is applied, you should see the vessel blanch. If there is insufficient current or pressure, the vessel will not blanch. It is important to use the point of the needle. Thread veins should only be treated once in a single session. It's important not to go over the thread veins more than once. If the needle is applied with too much pressure, and if the needle pierces the skin too deeply, there will be bleeding when the needle is withdrawn. It is important not to treat the thread veins too aggressively. Too much current, or applying the needle for an excessive amount of time, will damage the subcutaneous tissues and lead to scarring. It is better to err on the side of caution in the first instance. In my practice, I set the current to between 22 to 27 microamperes. If further treatment is required, it should be delayed for at least 6 weeks. Here we can see the results 6 weeks after one treatment. After successful shortwave diathermy treatment, the area should not be washed with soap and water for 72 hours. It is best to use a gentle cleanser, such as Cetaphil. You should avoid sun exposure for 2 weeks, and the area should not be scratched or stretched. If a second treatment is required, it should be scheduled for no sooner than 6 weeks.